To get a lot of questions about the TENS device. It's a question we get a lot in our groups. You can find them on Amazon. Is this something that you suggest patients get? Are there any types that are better than others that are out there? And how do you use them when you're walking?
We're doing quite a bit of research in TENS, and there's other people doing research in TENS and other electrical stimulation devices at the moment. We're not at the point that we know this works. So everything I tell you is my own experience or experience of patients, but this is not, you'll see it's not in guidelines, it's not recommended on widely. However, and I think, so one of what we found in our studies is that for some people, TENS works really well. For other people, they don't like the stimulation or it just doesn't work quite so much. The TENS device, but the good thing about TENS is that it's not, we haven't found that there's no safety issues. There's no harm that's been caused by using a TENS device and things like that. So what it can be conceived as is a safe thing to try. And because it's relatively inexpensive, so the units cost what, 10, 20 pounds or something like that, or around that amount. You know, it's something that if you're interested, if you think you might like it, you could give it a shot and see if it helps. In terms of where you get them from and if there's better or worse ones, again, not really. I mean, they all vary. If the more expensive ones would just have more buttons or more settings you can press, but you don't really need those buttons or settings. You know, you just need a standard device that will deliver electricity across your skin. And how you use it is that you place the electrodes. So generally you'll either have 2 electrodes or 4 electrodes, and you place those electrodes over the site you feel pain. So often I recommend over the where you feel the pain first or worst when you're walking. And then what you do is you just turn it on. So put your pads on at the start of the day when you know you're going to be doing a walk that would normally where you would feel pain. Switch it on at that point, and you need to turn it up so you can really feel the tingling across your skin as strongly as possible, and then you just start walking. And the way the TENS works is it doesn't take the pain away. It doesn't actually change what's going on in your tissues, but it uses the kind of distraction technique. So what you do is it's that concept of you can only ever feel one pain at once. So if you stub your toe and then you hit your thumb with a hammer, you're only going to feel your thumb or your toe. You definitely tend to feel both at the same time. And that's because your brain is only really able to process one pain at a time due to this pain gate mechanism. So that's what TENS does. It just gives you a different stimulation that distracts your brain, distracts your perception. And so what we found is some people think it works really well, and because they're not feeling the pain, they can walk a wee bit further. So that's the last thing I would say about TENS is that's it. You know, it's quite simple, but the actual electrical stimulation isn't doing anything different to your tissues. You're not changing anything particularly, but it's a crutch. It's a assistive device to help you walk. So it should be used in that context. It's to be used when walking to help you walk further rather than instead of walking. Walking is still the #1 thing you need to be doing.